All right, buckle up, everybody. We're going deep today into the world of labor and birth. We're cracking open a nursing textbook, talking all about the processes. And I got to say, even if you've been there, done that, you might be surprised by some of the stuff we're going to uncover today.
You know, it's funny. This chapter lays everything out like a recipe. 5 essential ingredients for a successful delivery. They call them the 5 Ps. Passageway, powers, passenger, position, and psychologic response.
Okay, a recipe for a baby, huh? I'm intrigued. Lay it on me. Let's start with this passageway. That's got to be the birth canal, right?
You got it. But here's the thing. It's not just a static tunnel like you might think. The whole thing transforms. It's wild. Bones, muscles, tissues, all working together to make room for the baby.
Really? So it's literally making space. That's kind of mind-blowing. And I guess those powers you mentioned are the ones making it happen.
Yeah. Exactly. We got to talk about primary powers and secondary powers. Primary powers, those are the involuntary contractions. They're the ones doing the real work, effacing and dilating the cervix. But later on, the birthing person gets in on the action. That's where the secondary powers come in, the pushing.
Gotcha. So it's like a tag team effort. First the contractions, then the pushing.
Yeah.
But how does all that actually work together for a successful birth?
It's pretty amazing, really. Think of the contractions like waves, gradually softening and opening the cervix, like a turtleneck being stretched over someone's head, and then it starts to open, like a flower blooming. Once that cervix is fully dilated, that's when the pushing kicks in. Helps move the baby through.
Okay, so cervix is open, got the power. Now what about the passenger? Is it really more than just the baby's size that matters?
Size is a factor, but the baby's position is key. Imagine trying to squeeze through a narrow doorway. Which way you're facing makes a big difference, right?
Yeah, I see where you're going with this.
So we gotta look at the baby's presentation. Head down, breech, or something else. Then there's fetal lie, how the baby's lying in relation to the mother's spine. And fetal attitude, like are they curled up or more extended? And finally, fetal position, which way are they facing? All these things affect how labor goes.
Wow, it's like a puzzle. All these pieces got to fit just right. And, hey, we can't forget about the placenta, right? That's got to come out too.
The placenta is definitely a VIP in this whole process. Speaking of process, let's move on to the position of the mother. This is where things get interesting. Different positions can actually change how labor progresses. Even things like circulation for both the birthing person and the baby.
So it's not just about comfort.
Nope, it's functional too.
Find what works, get moving. Now, what about this last P, the psychologic response?
Sure.
I bet we could do a whole deep dive on just that.
Oh, absolutely. Mental and emotional state can make a huge difference. But our textbook mainly sticks to the physical side of things, so we'll focus on that for now.
Makes sense. It's a good reminder that labor is more than just the physical stuff. All right, I'm ready for the guided tour. What are some of the signs that labor is on its way?
You might have heard of lightening. That's when the baby drops lower in the pelvis. A lot of folks feel relieved, like they can breathe easier.
Oh, makes sense.
Then there's the bloody show. Sounds scarier than it is. Just means the cervix is softening and changing.
Okay, so those are good signs, but not necessarily time to panic, right?
Right, just the body saying, hey, get ready, things are happening.
Gotcha. So let's talk about stage 1 of labor, the marathon stage, right?
It can be, for sure. It's the longest stage, from those first real contractions to full dilation. And here's the thing. The length of stage 1, it's all over the map, totally varies.
So no two labors are the same, makes sense. But once you hit full dilation, that's when the pushing starts.
You got it, stage 2. This is where those secondary powers come in. Breathing techniques are super important here. It's about working with your body, not against it.
Finding that rhythm, right? Now, stage 3 is kind of the forgotten stage, but it's super important.
Definitely got to get that placenta delivered. And our textbook makes it clear it's got to happen safely and completely. Otherwise, you can have complications.
They're not over till the placenta's out. And then we've got stage 4, all about rest to recovery.
Exactly. The first couple hours after birth. Time for bonding, recovering, maybe even a little nap.
I bet. It's amazing what the body goes through. Now, you mentioned these cardinal movements. Sounds kind of like a dance routine or something.
That's a great way to put it. The chapter breaks down these 7 movements. It's all about how the baby moves through the birth canal when they're head down, what we call vertex presentation.
Okay, I'm ready for the play-by-play. Walk me through it.
All right, picture this. The baby's head, it's like a tiny dancer navigating this crazy stage, pelvis.
I love it, tiny dancer. Okay, what's the first move?
First things first, gotta get engaged. That's when the widest part of the baby's head enters the pelvis, kind of like stepping onto the stage for the first time. Then comes descent, the big move, this downward movement. Happens throughout labor. But it's not just a straight shot down, there's more to it.
So it's not just dropping down. What else is going on?
As the head's coming down, it also flexes, tucks the chin to the chest, makes the head as small as possible, easier to move through the pelvis.
So the baby's getting all aerodynamic.
Exactly, like a little rocket ship.
Wow, it's amazing how the baby's actually working with the process.
It really is. And it gets even cooler. As the baby goes further down, the head rotates internally. Got to line up with the widest part of the pelvis. That's internal rotation.
Fascinating. But I imagine there's some wiggle room here, right? Not every baby's going to follow the exact same steps.
Oh, you're absolutely right. Every labor is its own thing. How the baby moves through can be different, depends on the baby's size, position, even the shape of the pelvis, and how strong those contractions are. But these cardinal movements, they give us a general idea, a roadmap, you could say.
Gotcha. A roadmap for the tiny dancer.
Mm.
Okay, so we've got engagement, descent, flexion, internal rotation. What are the last few moves in this dance?
So as the baby's head gets to the perineum, it extends, like looking up towards mom's belly button. We call that extension. Then comes restitution. The head rotates back, aligns with the shoulders again. And then external rotation. The shoulders line up with the pelvis. And that sets us up for the grand finale, expulsion.
Expulsion. That's the main event, the actual birth.
You got it. The baby's body emerges, and the journey's complete.
Wow, I never realized how intricate it all is. Really makes you appreciate the human body, huh?
It really does. So much power and wisdom. And while we're on the subject of amazing things, we got to talk about what's happening inside the baby during all this.
Oh yeah, the textbook mentioned that. Heart rate, circulation, even getting ready to breathe. What can you tell us about those fetal adaptations?
Well, think about it. The baby's heart rate's going up and down with the contractions. Respond to all the pressure. Like a little athlete pushing through a tough workout. Circulation changes too. Blood flow shifts. Got to make sure the brain and heart are getting what they need.
So the baby's really working hard too, not just along for the ride.
Exactly. And get this. The baby's actually getting ready to breathe air, lung fluids being absorbed, the respiratory system's prepping for that first big breath.
It's like they're training for a marathon they haven't even started yet.
Perfect analogy. And while all that's happening with the baby, the birthing person's body is going through some incredible stuff too.
Right. The chapter talked about changes everywhere.
Yeah.
Cardiovascular, respiratory, kidneys, even the skin. It's mind-blowing.
It is. But here's the thing. All those changes, they're normal. The body's just doing its thing. Heart rate and blood pressure go up. Got to keep up with the work. Breathing gets faster and deeper. Got to get more oxygen in. Kidneys work overtime, filtering everything. Even the skin stretches, making room for the uterus.
So it's not just about the baby being born. The birthing person's body is transforming too.
Absolutely. It's like a symphony. All these changes working together to make labor and birth happen.
And we don't even have to think about it. It just happens. Our bodies are pretty amazing.
They really are so resilient. But you know how it is. With something this complex, there's bound to be some myths and misconceptions floating around.
Oh yeah, for sure. And the chapter did mention a few of those. Should we tackle those now? Let's do it. I'm always hearing these things about labor that sound kind of fishy.
Well, one that comes up a lot is about pushing, in the second stage. The idea that you shouldn't push until you're fully dilated, 10 centimeters.
Yeah, I've heard that one. But the chapter seemed to say that's not always the case.
Right. Sometimes the urge to push comes earlier, especially if the baby's already low in the pelvis. It's called physiological pushing. Basically, the body's just doing its thing, helping the baby along.
So it's another case of trusting your body, going with the flow.
Exactly. Another myth we often hear is about cervical scarring, maybe from an old infection or surgery. Some folks think that it makes labor more painful, but that it won't actually slow down dilation.
That doesn't sound quite right to me.
Well, scar tissue can definitely make it harder for the cervix to dilate. It's something doctors keep a close eye on during labor. Might need some extra help in those cases.
So it's not just about pain. It can actually affect the whole process.
Absolutely. And then there's the whole breathing versus pushing thing. For a long time, they used to tell women to just breathe through it, resist the urge to push.
Oh, yeah, like in the movies. Pant, pant, pant.
Exactly. But newer research says listen to your body. If you feel the urge to push, push. Of course, working with your doctor or midwife is still important, and good breathing techniques help too. But it's not about ignoring your instincts.
It seems like a lot of these myths come from trying to control labor too much.
I think you're right, instead of just letting the body do what it knows how to do.
Right.
Speaking of which, the chapter had that multiple choice question about primary and secondary powers.
Oh, yeah, that one. The answer was that primary powers are what efface and dilate the cervix. but I think it's helpful to talk about why the other options were wrong.
Definitely. One of them said that for first-time moms, effacement usually happens way before dilation. Sometimes that's true, but not always. Every labor is different.
So important to remember, no two labors are exactly alike.
Exactly.
Wow, this has been a wild ride. I feel like I learned so much today, even though I thought I knew a bit about labor and birth already.
It's a constantly evolving field, always something new to learn.
So to wrap things up, what are some key takeaways for our listeners?
Well, first off, those 5 Ps: passageway, powers, passenger, position, and psychological response. Those are the foundation of the whole process. Got to understand those.
And remember, labor happens in stages, but each stage can be totally different for different people. There's no set timeline. Just trust your body and your healthcare provider.
We also talked about those incredible adaptations. In both the baby and the birthing person, nature is pretty amazing.
We busted some myths along the way, too. Makes you realize how important it is to get good information and to trust your instincts.
Absolutely. But this is just the beginning of the conversation, really. I wonder what our listeners are thinking now. What questions do they have?
That's a great point. What's something to leave them pondering?
Well, the chapter focused on the physical stuff, but we talked about how important the mental and emotional side is too. So how about this? If you could design the perfect birth and environment, what would it be like? And why?
Ooh, I like that. Makes you think about more than just the medical stuff. What would make you feel safe and comfortable? What kind of support would you want? What would create a sense of calm and confidence?
Exactly. So much to consider. It reminds us that birth is more than just a physical event. It's a powerful personal experience.
Absolutely. A journey.
To our listeners, keep exploring, keep asking questions, and keep trusting your instincts. Every birth story is unique and beautiful.
Well said. Thanks for joining us on this deep dive into labor and birth. Until next time.